So what if you're worried that you have a sexually transmitted infection? Whether you have symptoms or not, whether you had an unprotected event with someone that you're worried about, it's important to get tested. So what are those tests? You can get a urine test and blood test that will take care of the tests for the bacterial and viral infections that we care about the most. What are the STIs? The most common are the top six. There are 3 bacterial and 3 viral. The 3 bacterial are chlamydia, gonorrhea, and syphilis. And the 3 viral are herpes, HPV, and HIV. Now, there's some other somewhat lesser important STIs, but those are the main ones. Why do we break them down into those categories? Well, the bacterial ones, gonorrhea, chlamydia, and syphilis, are all curable. The viral ones, herpes, HPV, and HIV, we can treat, but we can't cure. We can also prevent, especially with HPV, with a vaccine, and we can prevent both sides with some medications in certain ways. There's doxy-PEP, doxycycline post-exposure prophylaxis, that protects against the bacterial infections by 60% of the time if taken within 72 hours after an unprotected event. And we have post-exposure and pre-exposure prophylaxis for HIV. And there are multiple types of the pre-exposure prophylaxis for HIV that includes pills and injections, and it can last various amounts of time. So if there are 1 or 2 things I want to tell each of you or anyone is that STIs are not a death sentence. And there are multiple ways to make sure that you don't pass on sexually transmitted infections to another person. 1 is getting tested and being cured if you're infected. And 2 is using prevention to make sure you don't pass anything on. And those prevention methods can be condoms and or medications in various ways, shape, or form.